Hi, I'm Andrea Kanaris, host of Voices of Change Stories That Matter. Today we're going to cover three topics. My guest is Sefton Darby. He wants to talk particularly about social performance broadly and also impacts, particularly intangible impacts, things like psychosocial, mental health, and including the mental health of practitioners. And then he'd like to talk a little bit about geopolitics and how the international and the local are a little bit more connected than we might think. So to get started, Sefton, if you could do a brief introduction to yourself.
Yeah, thanks, Andrea, and thanks for this amazing opportunity to be part of this really, really interesting series. It's been really interesting to see how all things social impact has been kind of growing over the past year, and all the different voices you're bringing into the conversation. As some people might detect from my inability to soften my vowels, I'm a Kiwi, and I grew up on the Otago Peninsula, which is a kind of a cold, windswept bit just outside of Dunedin in the south of the South Island. Both my parents were scientists, so I can tell you a lot about penguins. And you know, and that's important because it means that my early years were very much shaped by the environmental movement, by the conservation movement, and around what are the partnerships and what are the actions needed to conserve endangered species. And that's quite an interesting thing in terms of how governments and private interests and communities interact. And you kind of only go back and realise that's what was happening at the time, kind of later on, but that was certainly an early experience. I initially studied politics, and then I went to Scotland to do my master's degree. I went from one cold Scottish-inspired bit of New Zealand to an actual cold bit of Scotland to study international security, and then started my career in the UK government. Actually, I ran out of money and couldn't afford to fly home, so got a job in the UK Cabinet Office. So my first love is actually policy. Like I started off as a policy advisor, doing kind of public sector reform and technology policy, and very, very early internet kind of policy for the UK government, and wrote reports for the Prime Minister in that space. Then shifted over into aid and development work. And for initially the UK government, and then moved to Washington DC for the World Bank, and then after that working for myself, working on kind of governance and anti-corruption work in the oil and mining sector. So I had a good chunk of my life kind of spending a lot of time in some pretty challenging environments. Quite a few places where I was kind of, yeah, there was a good few moments of being genuinely terrified quite a lot of the time. And seeing an extraordinary range of players in the oil and mining sector, like all the way from large multinationals, you know, with very difficult and controversial projects, all the way through to, you know, artisanal miners, but, you know, effectively kind of three people in a pump and a shovel.
Yeah.
Interestingly, often quite hierarchically organised and controlled by a very small number of people, all the way through to kind of companies run by billionaires whose sole comparative advantage was being stupendously corrupt. And so, big chunk of work around that. Then I went and worked at a mine site for 2.5, 3 years. So I went and worked as an external affairs manager for a mine in New Zealand, going through a massive expansion. That was by far and away the hardest job I've ever done in my life. It was site-based. It was a really controversial expansion. Every day I was learning something new. And from there, I then was one of the regulators of the mining sector. So I was the National Manager of Minerals for the New Zealand government for a couple of years. And then since then, I've been in consultancy. So jumped all over the place.
Fantastic. I mean, I couldn't think of any. It's exactly the kind of reason that I, started this podcast, to be able to talk to people with such a depth and breadth of experience. And the one thing that you said you were particularly passionate about across all your experiences was the social performance side, as opposed to sort of social impact, but really social performance. And before we were talking, before we started, we were having a bit of a chat, and you sort of talked a little bit around your thoughts on social performance and their interrelatedness to social impact. But would you like unpacking, your view on social performance and why you see it as so critical?
I mean, I think first of all, a disclaimer in that there's in certain conferences in certain corners of the internet, there's an incredibly boring conversation about what do we call this, and that's, is it social performance, or is it social impact, or is it social value, or is it social license, and what does it mean? And yes, words matter, but I'm not a labeling fundamentalist. But I use social performance as a descriptor for what I'm really interested in, because I'm interested in every aspect of how an organisation interacts with a community, creates risks for those community managers, impacts, how it structures itself, how it organises itself, not just in a impact created, impact managed kind of type thing. So I'm really interested in that whole of organisation response. I'm really interested in the whole engagement piece.
Yes.
And kind of both around social impact as well as around the day-to-day operations of an organisation. And actually not just an organisation, even just around specific policies or projects that are being put out and how they impact on people. So that's, and within that, there is obviously a really hugely important part, which is understanding social impacts and understanding what to do about them. And of course, that should mean a really good read back into what should the organisation do, which sometimes happens and sometimes doesn't happen.
Yeah. Yeah. And social impact happens in so many different ways, and so does performance. So why does how a company organise itself and deliver its services matter in terms of social performance from a community perspective? Because I think this is where a lot of people get confused, I guess. So or they focus internally and forget the external for the community, or they're focused only on the community and don't get the internal. So would you like to sort of unpack that a little bit to sort of say, why does it matter, I guess? Why should we be thinking about this?
It matters because if you don't understand the entire organisational context, if you're not working on that, then the way social impacts are going to play out is going to be much, much worse. I'll go so far as to say, if often my advice when I'm going into an organisation and they're about to launch a comms campaign, or they're about to kind of go out and explain what's happening with the social impact assessment, or they're about to announce a project or an expansion, and often my first piece of advice would be, take your comms strategy and lift it off the desk and shift it over here to where the rubbish bin is and just place it gently there. And now let's start thinking about what's happening inside your organisation and why that matters, and why I feel compelled to give that advice a lot of the time is because often teams have received a project or a policy or an initiative, and there has been very little critical evaluation within the organisation as to what the social impacts are or what the social risks are. It's more, here it is, you go and do your community engagement piece, you go and do your social impact assessment, and come back, we'll speak in 6 months from now. And I'm struck by the number of community-facing teams I work with, and I will say, have you had a conversation with, HR around what your hiring practices? Have you talked to finance about how do you pay your contractors? Have you talked to supply chain about how they manage supply chain? Have you actually talked to the operations people who are creating the impact? Have you talked to the engineers about the design options that you've got here? And there is often a devastating silence at that point, where they have thought that their job is to take what has been received and effectively go out and comms it or do a social impact assessment on it. And so that's why I very starkly say go put that comms plan in the bin and focus on the internal first.
Yeah, that's really nice articulate, because not many people talk about that interface between that internal with the external, and really making that link between it. I know that if I'm hearing you right, there's a lot of people, and it's been my experience, that there's a decision being made, or so we're going to do it, and they're stuck in what I suppose, if you look at IAP2 or those, I guess, spectrums of how you engage, they sit pretty much on the informs end, right? We've decided what we're going to do, and we've written this whole comms plan around, we're just going to go and tell the community what we're doing. So is that have I understood correctly?
So IOP2 is really interesting, right? Because I have grudging respect for how far it's penetrated into HR world, into job descriptions, into definitions of what good practice is. And I'm glad there is something there. But I also think IOP2 is part of the problem in terms of it does imply a starting point is first go out and engage.
Yes.
And I was struck so ICMM, International Council on Minerals Metals, did a really good competency framework on social performance. And actually, when you look at the skills identified in that, a huge amount of the social performance skills and experience they define there are internal influence skills. If you're a community engagement manager, if you're a social performance manager, if you're inside the project, you should be spending a huge amount of time influencing inside the organisation to improve the outcomes for people outside of the organisation. And that's where I see engagement spectrums as helpful, but starting in the wrong place.
Yes, I think that's well put, because I believe that you need both. They need to meet, which I think is what you're saying. And it's an interesting thing. And a lot of things fail and fall apart when that lack of understanding internally is there. And if you're treating it just as an inform, and if you're just, I suppose, like anything, the tick box just keeps coming up, right? If you're just sort of going, I've done step one and I'm going to do step two. And this is I mean, we all love a good framework, but there's a problem if you stick to a framework as some kind of religion, right? That you let it turn your critical thinking off around what's actually best for the situation you're in, be that the organisation or the project or the initiative, like you say. And really,
I've also been struck by when you pull all those other parts of the organisation into the room. I've never been in one of those conversations in which I have come out of it without 3 or 4 different ways of doing something better, which the community engagement team wasn't even aware of, or didn't even know they could influence the project that way. And engineers will kind of go, oh yeah, actually we could put it there, not there, or actually, we could change our hours of operation, or actually, we'll go away and think about whether there's a technological fix to this impact that we're creating. And it's not that the engineers or the operators are bad people kind of creating noise. It's just people haven't asked them the question before.
And if you don't know what question to ask, to be fair, then how do you even know what to ask and who to ask? So this is
and right on that is it requires you to spend a lot of time in rooms asking very dumb questions. Like you need to go and ask your supply chain person a bunch of questions about supply chain that you don't know, and engineers stuff about engineering stuff that you don't know. But if you can get over that discomfort, the opportunity there is huge.
Yeah, I like that. I think it's really important. You have to really lean into, there is no dumb question, just keep asking questions. But here's my question, because social impact to me quite often gets thought about after all of this happens. So some of the answers around that, what questions you need to be asked seems to be a little bit around understanding some of the social risks, the potential social impacts, at least the early thinking around what those might be. So how does that happen in this context? Because to me, it doesn't always happen.
No, we're often pigeonholed into manage or mitigate, right? In terms of there's going to be an impact, and your job is to either explain it to the world or find a way of making it less worse. And don't get me wrong, there are ways of carrying out consultation and engagement where you can do it in ways which actually tangibly make people more comfortable with the impacts that they're going to experience. How that is done is really, really important. But a lot of lost opportunity is actually in the avoidance space, which actually the project didn't have to create this impact in the first place. Or actually there was a failure there was an opportunity to create a positive impact that didn't happen. I had this amazing project where we got bought in by a company, and they were looking at they wanted a social risk assessment of all of their future expansion options. And so they had 14 different expansion options, and they did an economic analysis, a regulatory analysis. So how much cost and benefit, regulatory analysis, how long is it going to take, how much is what's the regulator going to like or not like, and then a social one, which a team of people and I did. And it was amazing, right? Because what they were trying to do is knock out the really horrifying ones before they even got off the ground. It's kind of like, well, let's not even go there with further design. Let's not even do that because of that. And very few organizations do that level of kind of high level risk assessment And that's why often people are left receiving a project and managing and mitigating the issues rather than avoiding them in the first place.
That's such a great observation. And it's been, I think, the frustration of a lot of social practitioners, myself included, where you think by the time we're brought in, it's like, well, it's a bit late now. Because all of the things that I want to tell you, we could have avoided so much of this had you brought me in a little bit earlier, so we could have explored some of these potential impacts and avoided them. You're either not brought in early or they haven't got the in-house, I guess, capability to consider it. Or maybe it's culture. I don't know. That's an interesting.
I think it's heavily culture driven. I think, there's quite a few organisations in which services, so anything that is not production related or explicitly, seen as kind of creating dollars, is seen as a cost off the bottom line, and they're put in a box over here to deal with stuff. And I think that's partly around not understanding that actually in the social and the community side can be hugely positive to the bottom line in terms of making sure that projects stay on a reasonable timeline, avoiding costly disputes. And there's this kind of wonderful thing in these companies where they kind of take a terrible project out there and then they're going to go, we've been delayed by a year because everybody's angry and the regulators, and it's just these terrible irrational people. And I often kind of go, well, you could have saved yourself hundreds of millions if you'd started thinking about this 2 years ago, But I think it's also in social performance and social impact land, that does require us to speak more of that internal language. It does require us to speak the language of risk. It does require us to speak the language of finance. It does require us to be able to understand how to influence our own hierarchy. And I think sometimes we're not great at that, to be honest.
Yeah, I often say that I think I'm in for this radical responsibility, and it's like it's easy to point at other people, but as a profession, we should be looking to improve all the time. And part of that, I recognize the same thing, that sometimes we have to accept that if we want to bridge that gap between the social practitioners and perhaps the finance people, the business, the engineers, then we do have to somewhat find language and at least seek to understand where they're coming from so that we can have better conversations. So I really like that.
Absolutely.
Yeah. And you touched on, tangible impacts, and it just is a good segue into talking about the intangible, which you had a lot to say about. And it's a really interesting conversation that I think our viewers will really like around the intangible impacts. And you mentioned in particular like psychosocial and mental health kind of impacts, but not just on communities, but you also mentioned it in regards to practitioners. So I don't know where you want to start wherever you want to like, but I think all of that's extremely interesting.
I mean, I'll start in a really tangible place, which is just in case people think I'm going to go off on a hobby horse. Like if you go and look at the New South Wales guidelines around, and it kind of gives you some categories of impacts. And one of those categories of impacts is decision-making systems. Now,
yes,
I can remember a year or two ago just taking a random grab of 20 SIAs out of the major project portal just to see if any of them was talking about either decision-making systems or psychosocial. And surprise, surprise, I think I found like one or two out of the 20 or so that I looked like nobody was talking about it. So there is a place really clearly in the regulatory guidelines saying, look at this, yes, please. And so I'm really, first of all, really interested in decision-making systems in terms of the evidence is really clear that actually how people are treated, how they are engaged with, whether they have a sense of agency or whether they feel like they're just being railroaded, their sense of fairness around process, around response, around even distribution of benefits and impacts, that stuff really, really matters. And yet I often dive into an SIA and it's kind of like, well, there's going to be some amenity impacts and some traffic impacts and some noise impacts and some...
Yeah.
And it's like, yeah, that's great. And that's not actually what's going to be motivating people to appeal. I think what actually often motivates people to appeal is a profound sense of kind of lack of fairness, a sense that they've been railroaded into something that is a fait accompli, and often profound distress that they feel like they're losing their place. And it goes to the second point around psychosocial impacts. There's some horrible language in planning land and regulatory land around this, right? Like the sensitive receptors. Well, what, like the first time I read that, I kind of thought, oh, is that like some sort of monitoring tool? And then I discovered it's a human being. It's a way of describing someone.
That is my pet hate, by the way. I just refuse to use that terminology. It's disgusting. It's dehumanizing.
And I still see it used today.
Yep, all the time.
And
all the time.
If someone says that in my presence, I will always say, oh, you mean a human?
Yeah, I'm not the only one. I say that all the time. You mean human people. And
so, I mean, perhaps I'll give a working example here. When I worked at that job at a mine site, it was a mine in the middle of a town, and it was an open pit mine, an underground mine, and it had really significant impacts on people. And we got lots and lots of complaints. And when I looked at the distribution of those complaints or concerns, it was slightly geographical. It was slightly related to proximity to the impact. But I would say the strongest driver of distress was not actually proximity. It was actually vulnerability. It was actually how that person was going in their life. And for some people, an escalation of impacts or even the announcement of a new project can tip stress over into anxiety, into depression, into a sense of having no control over your own life or even your own home.
Yes.
And yet when I look at social impact assessments, no one's putting the label on that needs to be put on it, which is mental health. There are profound mental health impacts of changes in policy and new projects and new initiatives, and no one wants to call it what it is.
I find that really interesting. This is one thing where I'm finding that we're in complete alignment on agreement, and not I identify the same thing. So I have a public health background. Prior to part of backwards and forwards into the private sector was being in government, and primarily in Queensland Health. So, public health in particular, understanding the social determinants of health. And most of the time I see social impacts talking about health and wellbeing impacts, but you go to the baseline and there's no data around social impacts or any of the things that you would say that would point to something that may be a determinant of health. And yet they're making these grand statements around how someone's health is being affected. And I'm like, well, how can you say that if you don't know what their starting point was, which I think is what you're alluding to. And also I've been in projects where I've seen somebody's reaction to, all the technical reports would say that there was no vibration, no movement in the house, all the measures sort of said no, but this person was, and having interviewed them several times, as was the other, the distress was real. It was not performative. It was not, it was 100% genuine. There was no way you could deny that this person was being genuinely affected by this project and by the and it was about vulnerability. Most of the people do such a blanket thing that they don't drill down into their people who are vulnerable, like you say, in many ways. And, mental health is just one of them. There's lots of other things. It can be, the other one I see is like respiratory conditions. If you've got dust around construction or any of these kind of areas, if you've got respiratory conditions, then you're more vulnerable to impacts than somebody else. And this level that has been set in technical reports may work for the broader population, but for someone who's vulnerable, they can be far more sensitive. And I think that doesn't always get borne out in impact assessments.
First of all, there is good data on this. Like in the last census, it included self-reporting on mental health issues, and there's some really, really interesting data around disability and physical and mental health conditions that people live with. And I've been surprised just in the census data at like I'm assuming that there's a chunk of people who aren't reporting in that, and so it's interesting.
Definitely. Yeah.
Quite level of kind of reporting that's already in the data. But you made a really important thing in there, which is that there are these multiple determinants of vulnerability. And if I think back to that mine, as the manager of the team, I kind of got, my team would often kind of save me up for almost the worst conversations or the hardest conversations. And so I would be sitting in somebody's living room, and the first 20 minutes was normally a bit of a monologue about how terrible the mine was and how we were personally culpable for everything that had ever gone wrong in the person's life. And without fail, between minutes 20 and 25, one of the following things came out: loss of employment, relationship breakdown, kids interacting with the justice system, physical health, change in physical health, need to access services, ... There was almost always a really important other thing.
Yes.
Sometimes a project proponent might say, well, nothing to do with me. But what I also know, and what you just described, where you kind of said you talk to these people, it's not performative, is that the new impact or the new project or even the new policy is often a tipping point. It is certainly a thing that then massively exacerbates.
Yes.
And I think we are being dishonest to ourselves as a profession to hide that under other labels. But we're also then shutting down avenues for doing something about that.
Yes.
So I have had a client who actually did put funding into local mental health services and increased the staffing in the mental health provider by one person, because they realised for a particular segment of the community that they were going to really struggle with that local resources in that space were really constrained.
Yeah.
And that was we they wouldn't have been able to have that conversation about, do we need to up the counselling resource in this community, if they hadn't first been able to talk about mental health and distress and vulnerability.
Yeah, and that's been my experience, and I think you point to something critically important, which is by not digging into those things and by stepping away from it or hiding it under something else, you really can't have a conversation. So you're missing huge opportunities to actually make a difference, to, well, avoid one, but also even where maybe you can't avoid is what can be done about it to mitigate, manage, give the opportunity to relieve some of that burden on the communities that are actually, particularly the vulnerable groups that are experiencing these issues.
So a really good example of that is historically when companies think about, I'm going to impact on these people, and actually in some cases the impact's so severe, I'm going to start thinking about compensation offers or even resettlement or whatever. And the company I was working in at that mine had historically gone out with a defined offer. Hey, we've got a new project, and here's the option to buy a house. Here's the money for the community. Well, actually, one of the best things you can do to reduce people's mental distress is give them a sense of control over their own lives. Yes. So actually what we then did is kind of go, well, actually what really matters when it comes to community investment and even compensation is optionality. Give people options that suit different stages and different concerns in their life. Yes. And rather than just say, here's the deal, lump it or like it, lump it or leave it, And it's amazing how much distress you can address if you give people choice and if you give them a sense of control back in their life where they feel that they have lost control.
Perfect. I couldn't help but thinking, and I was thinking some projects that I've been involved in as you were speaking, and I'm thinking the most effective ones is where you're enabled to do that, where social impact assessment is not separate from performance, it's not separate from design, it is a co-design process in itself, which allows the organization to make decisions about the project, about the design as they go, as opposed to a report, it just being the ability to deliver a report in order to get an approval. And when you have that relationship, they've always been the most successful social impact assessments that I've had. And when I say successful, it means in that the least amount of resistance from community, not because they didn't have issues or concerns about impacts, but the company was willing to see the SIA and leverage that as a way to understand deeply their concerns and address them as they went along. So that when you got to the point where you were writing a report, they'd already designed things out, negotiated mitigations or solutions to the problems of the community, and which gives kind of empowerment to communities too, because they know that they're being heard, they've got choices and a say in what's happening to them rather than it just happening to them.
But it requires those companies or even government agencies, it requires them to kind of hold their breath a bit, because there's going to be a horrible bit, right? And the horrible bit is actually you're going to have to give it a bit of time. And a lot of people, I had a couple of years on that particular project. The first year was just getting shouted at a lot, to be honest. And it was and then still turning up again and again and again and again. And then you build trust and you build relationships, and then you can start bringing that out. But for a lot of organizations, it is far more psychologically comfortable for them to kind of go, right, we've got a project, here's our impacts and here's our solution, and we don't have to have any awkward conversations with people around changing anything or options. And I often think that they do that because it's actually psychologically easy for them to do that. It's comfortable for them to do that.
Yes.
They don't have to put themselves in any uncomfortable positions, and yet they are also the same people who 2 years down the track kind of go, oh, project delayed. How did that happen? How did I lose $500 million because it got delayed?
I know. And yet, to be fair, and not just to them, but even to our own profession, like we were discussing before, and psychosocial is complex. Like we've seen it emerge. You and I both agree that it's important. Like we can see the significance of it. There's some real complexities about it. It's not easy to understand. I would say most people, even who've got a background in, say, health, would struggle with understanding what psychosocial actually is, let alone how to collect a baseline that allows you to even determine where to start, and then how do you measure it, and then who's actually responsible for it at the community level. Like it's rather a complex issue, isn't it? Like, I mean, does it need an expert on its own? Should it be put in the hands of the social impact professional? I mean,
it depends on the problem. And I guess when I was working on that particular project, it was really obvious. We were, the company I was working for was mining under people's homes. It was pretty
clear.
It was reasonably explicit. And I mean, the one little, as you were describing that, the one little twinge I had there was kind of like, well, do we have to measure it? Or sometimes actually, like I know from an impact assessment point of view, from a impact measurement, from a regulatory point of view, it's good to say we've had this impact and now we're measuring it and we know whether it's changing. I always think there's a certain category of impacts where sometimes they have to be just slightly faith-based, to be honest. Like you do actually just do it and you don't know if it's going to work. It's what an old boss of mine, and actually my very first job in the UK Cabinet Office, he used to call it kind of policy-based evidence making, which is sometimes you just had to go out and do something to see what happened, because actually there wasn't a lot of evidence initially, but you had instinctively, you had read the room, you had figured out what was going on, and you may not have had any precedent, you may not have had any data. Yes, go out and get the data now, but that doesn't mean don't start something.
I absolutely love that, because it aligns with my view around qualitative and the importance of qualitative in the social impact in particular. There's a lot of stuff that we know you can't. There are some things you can clearly measure. It's a lot easier for some things. There's a whole lot of data. Some of it social, some of it health data, some of it economic, whatever. There is also a hell of a lot of stuff that we just kind of, like you say, intrinsically know, and it's because we've been talking in detail and collecting qualitative data that we're digging deep and we can tell that there's something going on. And I agree that that should be enough. But doesn't that also draw attention to the fact and the absolute importance of monitoring? Because it's one thing to say, dive in deep because we know something's going on here. That has to be coupled with monitoring so that we can and check our own assumptions on, is what we thought we saw what we actually saw or heard or whatever, so that we can actually tweak it. Because usually what we're alluding to is things that we've got a pretty much gut idea about. We think we think we know. We're going to take a leap of faith and we're going to dive into it. There's also an obligation to monitor it just to make sure that you've got that right. And that you can tweak it as you go along to refine it.
So a couple of things in there. I mean, first of all, there's just as the what do we call this thing that we're doing debate can be a bit boring. The quant versus qual thing is endlessly terrifying, because the answer is it's both,
Exactly.
And if you haven't got awesome, long-standing community sentiment data, and then what are you doing? To be honest, because you will be spending millions, if not hundreds of millions of dollars on other aspects of this project, and for very little money you can get, you can invest in good long-term quantitative data sets, and that is imperative. But risk is also incredibly specific, and there's a bunch of stuff that hides beyond the range of quantitative data in the qualitative realm. And so I just I've ended up in lots of conversations over the years where people are getting fundamentalist about kind of quantum qual, and I just find that excruciating.
But likewise, I thought we prosecuted that a long time ago, and that everyone accepted is both. But apparently, some people still want to.
Oh, it's still going. But to the second point, which is the monitoring piece, it's interesting. It's something I was talking to some people about just last night. So in some ways, we're captive of some of our regulatory systems where so much focus is put in on an approval process, on when a permit or a license has been granted.
Mm-hmm.
And yet, it wasn't really until I was a regulator for a couple of years. Every day I went into work, there was a queue of 300-400 mining permit, exploration permit kind of applications that the team needed to work through, and a huge number of change applications in there. And the amount of change that happens inside projects beyond the approval process is just vast, and happens to communities beyond the original approval is often, when you stack up all of those change applications, often quite radical. They're often dealing with a different project and a different company and a different set of impacts from what was assessed 10 years ago. Yeah. And that's why that ongoing monitoring piece is utterly critical.
Yeah, 100%. That's been my experience. It's and it's the one thing that always sits uncomfortably with me when I'm doing a social impact assessment, is that kind of click that seems to, okay, well, I've handed in they've got the approval and like, bye. And you're like, well, where's this monitoring going? I mean, thankfully in Queensland, we're seeing SIMPs being introduced. I know New South Wales are looking at SIMPs a little bit more seriously, but it is concerning that they're not more of an intricate part of what we do and what is expected. And I'm thinking more from a regulatory perspective here, that companies quite often, again, unless they've got a culture of otherwise, are going to do what they're expected to do, not necessarily what's good to
do. And I think the challenge back there is also we've kind of slipped into this kind of, well, it's on the companies thing. Well, actually, I would actually push back and say I'd be a pretty big vote in favour of stronger compliance functions in a lot of regulators, and often a lot of the resourcing is at that upfront approvals process, and then you've got these minuscule little compliance teams who are spread really, really thinly, and they, really good people, but their ability to pick up a substantial change in how a company or a project is operating, there's just often not enough of them to cover that. There's not enough of them to get out on the ground and see it. And so kind of actually governments and regulators checking back in with communities, not just when it blows up.
Yeah, I agree. For my background in regulation in various different areas in health, is that the best thing is that you have, spot checks, right? That it's just random spot checks across. That takes a team. It also takes a team that has the capability and capacity, not just capacity, but capability to do that. They've got to know what they're looking for. And government regulators don't necessarily always have that deep background. Some do, some don't. I mean, I think it's varied. But it's probably varied because they don't have the compliance function as a core piece of their work. So, you're not going to invest in staff that are heavily compliance driven when that's not a bulk of their work. It does.
I think because compliance is coming with, it's seen as a negative, punitive, and compliance doesn't have to be that. It's asking a simple question, which is, are you operating in a way that you're regulated to operate? Because that regulation is an agreement between effectively the government, the company, and the community that's involved.
Mm.
And we all, like I've seen it, if you get compliance people within companies or even within governments who are too much in kind of police person mode, people start concealing stuff, right? They start hiding stuff.
Right.
The best compliance people are the people who've got a really awesome balance between kind of the ability to work with the people on the projects, but also to call out poor performance where they see it. And if you're all the way down the policeman end of the spectrum, you just won't get the data. You won't be led into the room to find out what the problem is.
Exactly. There needs to be a collaborative element to compliance. It has to be a collaboration to make sure. And even when you find something that's not working, I mean, the whole approach should be, how do we work together to rectify this? Not like you say, the punitive approach. We've explored a lot about that intangible in terms of the community and the organisation, but there was something else that we touched on that I think is really important. I think even for our audience, because a lot of them will be in this category, as in we're dealing with this, and that's the mental health of practitioners as well. It's not just communities, it's not just the organisations, but it's also practitioners who are dealing, like you rightly pointed out, on the front line, dealing with some pretty sometimes distressing circumstances.
So yeah, and my starting point from that was when I was leaving that job at the mine site, and I was asked to go and present on what we'd done within the company and to the regional leadership team and to a bunch of other people, and to think about because it had worked really well. We'd taken a radically different approach to understanding our impacts and engaging with the community. But when I also got to the question of like, well, what should I have done that I didn't do? My number one regret was not putting in kind of psychological support for the team. And I had a team of people who kind of 2.5 years in were worn out. They were sick. There was, a high degree of physical illness following psychological stress. If you stress people again and again and again and again, and you do it every single day for 2 years, it's what people get sick. It becomes real.
Yes.
And so that was the first point at which I started really thinking about this interesting dynamic for both practitioners, even if they are outside consultants, but particularly inside the organisation, to be good at social performance, to be good at community engagement, requires you to be both an insider and an outsider in your employer and in your own community. And that is a very stressful thing to do day in, day out, to be an insider and outsider both in your own community and where you work.
Yes.
And I think, you and I talked about it, that the profession by definition attracts people with high levels of empathy. Definitely. Because that's what you need to do those jobs. You need to be able to put yourself in somebody else's shoes. You need to be able to spot distress when you see it. You need to be able to ask the third and the fourth question when you see that distress to try and understand it more. Mm-hmm. But recognizing that people are both insiders and outsiders, recognizing that they are highly empathetic, I think organizations need to think really hard around what are the supports they put in places for those teams. And it's not just, well, we've got an EAP, give them a call. Like it needs to be more than that. Thank you very much.
EAP. Yeah, avoidance is better than a cure. EAP is kind of too late if they're at EAP point.
Yeah.
A lot of the time. And I think my observation is and I see the reason this is important. And, I remember in one of my first jobs, and it was settling refugees. And you're listening to traumatized people's stories, because anyone who's worked with anyone who's traumatized knows that you can't help them, or you can't work with them until they trust you. And trusting them, part of that trust is them telling you their story. Like that's when it's kind of the indicator that that you've got their trust, that they're volunteering their story to you, because we're not owed someone's story. I know that's hard for people to believe in the modern day of social media, but in fact, people quite often won't tell you their deepest, darkest stories until they feel a level of trust, particularly traumatized people. And when you're taking that on as an empath, I know that it's really hard that you can very much be taking that on. And when I think of some of the work that people do in the social impact space, and if you look at that social impact space being the broadest, then we are talking about dealing with people who have had resettlement in third world countries, in developing countries, however the language is that you want to refer to them. But people who are living in dire circumstances, under terrible conditions, experiencing terrible traumas, and not only hearing the stories, but can witness the circumstances in which people are living. And I think it's not talked about enough on how that affects the psyche and the mental health of practitioners, particularly the longer you're doing it. If you are not intrinsically putting something in place that helps you to deal with what you're seeing, hearing, maybe even experiencing in some circumstances, because I know if you think of social impact in its very broadest sense, you may be witness to or having to intervene in things like domestic violence, all sorts of things. Those things are traumatic experiences. And even if they're not traumatic, they're very difficult, challenging, harmful things to see. And we know that when we see incivility, where we see violence, where we see these kinds of things, it does affect us. And the more empathetic you are, I would say, the deeper that effect is. So, for example, if you take psychology, and when you're working, quite often these social workers, you have to talk to people all the time. They have debrief sessions all the time. Like, it's managed continually. I wonder why our profession doesn't have this inbuilt in it, that there is a buddy or somebody that is external from what you're experiencing that you have to see on a weekly basis to help debrief on what you saw, how you're experiencing, to make sure that you're not internalizing it, because it's very easy to start thinking that somebody else's experience is kind of your experiences, and
So
it's
that debriefing is absolutely bang on.
yeah.
The people we got in belatedly 2 years into that project was actually a psychologist who spent a lot of time working with the police, because actually there's another profession where day in, day out, you are exposed to extremely traumatic situations, and yet you have to, absolutely to the best of your ability, turn up and be professional every single day under circumstances, and often under extreme provocation, and it's incredibly difficult. And your link to the health system is a really great one right here, which is,
Exactly.
So doctors, if a doctor takes on everything that a patient tells them, then they will go insane. They won't be able to do their job properly. You need some psychological distance. But if you take on none of it, you're going to be a terrible doctor. You don't know who you're working with. Now, actually, a lot of the medical profession does have that debrief kind of process around. Today, someone died, or today I told someone that they had a terrible condition, or and actually, you have to debrief. You have to do that. And so I think my big number one would be, yes, you need to have a culture of debrief, and then the second thing is still think about kind of mental health in an internal sense. So I'll not name names here, but I have a place that I worked once, which was very self-congratulatory about their approach to mental health, and you kind of go onto their intranet, and there'd be a list of kind of things they're doing on mental health, and everything in that list was what you can do for yourself for your mental health concerns, right? There was nothing to do with that actually a lot of the things that were exacerbating that was management behavior. Was about how people were treated in the workplace, was about allocation of work, was just around defining acceptable norms of how people interact in the workplace, how feedback is given or not given, how senior people kind of interact or instruct junior people. And so one, definitely the debrief process, but two, thinking about that internal side, which is it's not just about giving resources for people to help themselves, but recognizing, especially with teams who are working in the community, that there is a vulnerability there. And that organisations need to be incredibly professional about how they interact.
Yes, there has to be you have to try and embed a culture of a good mental health, which is really hard to define. But there are some obvious ones. Bullying, asking people. It's not just asking people how they are, but it's being cued into signs that somebody may not be coping, or somebody's maybe internalizing. Because I think that's the biggest danger from an individual perspective, is that you're internalizing something that's actually not your experience. And I think in our field, it's very easy to do. And I think you're right to pointing to health, having had a background working with health and health professionals, is that they do it exceptionally well. And they have they develop a lot of all sorts of mechanisms to help protect themselves from that. One of it is a dark humor. People in emergency rooms and medical professionals
Same with police. Lots of dark humour, right?
have the darkest humor. And people from the outside can often be critical. And like I said to them, like, they're dealing with this every day. They have to have some kind of
They have
wall
to
to
have
stop them from internalizing that. And humor is one of them. Like you say, the debrief, but also adopting this kind of more professional relationship with patients. We get a lot of people talking about bedside manners. And I say to people, when you've got to have someone operate on your heart, you want them to be focused on the precision of their surgery, not, being your bestie at the bedside,
It's an
right?
incredibly difficult balance, right?
It is a difficult balance. And yes, some, like as you pointed out, some can have absolutely no bedside. But I often say that if it comes to saving my life, I mean, I've got friends. I'm quite happy to have them be, that little bit less on the friendly side. But there are things that we can definitely learn as a profession, I think, from looking at things like ambulance, fireys, like you said, the health professions who deal with this on a daily basis and have structures in place that help with that. Because I do think that particularly those who work in, very frontline positions where they're dealing with extremely vulnerable people and very difficult, challenging situations, because the chances are the fact that we're doing this work is that they are empathetic, and you need to also have things that protect you from developing, poor mental health, be it from stress, be it from internalizing something that's really doesn't belong with you. It's somebody else's, and being able to learn how to separate that, because it's not an easy thing to do for an empath.
No, it's hard, and I've seen people leave the profession because of it.
Well, I'll be perfectly honest. I left working with refugees because of that exactly thing. I struggled to completely separate from hearing those horrific stories. They still live with me today. Because once you've heard those things, you can't unhear them. There are things that you see you can't unsee, and you have to know who you are. And that was certainly something that I realized I don't think I can do that. And nursing was another thing I considered, or medicine, and I realized that I can't do some of those things either. Like, apart from the fact that if someone throws up, I'm move over, I'm joining them. But that aside, and it is about knowing yourself. And if you are an empath, you need to learn strategies, I think, for sure.
And I think, I don't want this to kind of get kind of packaged up and lumped as, oh, well, they're all empathetic and
No,
they
not
need
everyone
someone
is.
to hold their hand. And that all of those processes are backed up by really good internal culture in which,
Yeah.
in which bullying is not tolerated, in which people are treated with respect, in which managers understand how to manage. Like there's a real focus on the kind of cult of leadership, but actually there's some really kind of boring management skill basics about just how to interact with people in their day-to-day work.
Yes.
And I think particularly with people who are in these professions with high exposure to difficult situations, difficult conversations, then that internal discipline, that internal culture needs to be really rigorous. And a lot of the time it's not.
No. Well, and also because a lot of people would be sitting in organizations where you are a small team whose function does not align with the rest of the organization's functions. So, for example, if you're in an engineering firm, you're this small team of 5 people, and the thousands of people around you are doing something else. So their level of understanding of what you do is not necessarily there. So there is a challenge. I suppose my advice to people is, if you haven't got an organization that has these kinds of mechanisms set up, then try and set something up for yourself, because regardless of that, you're going to need support, right? Yeah, because you can't. So there was one other things we want to talk about, and I'm conscious of time. I want to make sure we touch on this because it was something that you thought was important, and it's something you've got an interest in, and that was what is it? I'm going to ask you, what has international got to do with the local?
Yeah.
And why should we care? What's happening internationally?
And again, it could have came out of looking at some of my more recent work and seeing that we we treat communities as if they're slightly hermetically sealed, kind of, here's a community and I'm going to study it under the microscope and interact with it. And yet, I have this real sense, and it's partly from my initial training in international security, that like the international is intruding into our living rooms on a daily basis, and not just through the TV. So if we think over the past couple of years, some of the big cost of living spikes have been energy and food. Well, I can tell you a large chunk of that has kind of come out of the war in Ukraine initially. And I've spent some time there, both before and after the war started in 2014. And so, we talk about cost of living. Well, that's geopolitical. There's a high degree of economic uncertainty at the moment. Well, that's geopolitical. There's a high degree of share market kind of volatility, travel disruptions. That's geopolitics, and it is playing out at a really micro level. Just even the fundamentals of trust, of what is trusted information, misinformation, degrees of polarization. Like I'm struck by how similar, for example, the rise in kind of nationalistic movements across multiple countries is, and it's playing out in local communities. Like, now that is a global phenomenon with some really, really interesting. I mean, it's kind of interesting seeing the linkages develop between different extreme nationalistic groups. You'd kind of think by definition they don't like each other, but there's actually an awful lot of commonality in approach and what they want to see in the world. And even looking forward, migration and displacement. Think back to one of your first jobs. The drivers of that. If you look, I mean, I haven't looked for a few years. I can remember looking at the kind of the migration stats into Europe a couple of years ago, and all of those were being driven, or virtually all of those were being driven by conflict or by extreme authoritarian governments. And so just I think there's this world in which somehow foreign policy is over here and geopolitics is over here and local is over here. And one of our jobs is to actually realize that actually there's a kind of a stretchy line between them, and understanding the context of these communities, just kind of lifting our eyes from the community and kind of understanding what's happening out here is actually really, really important.
So from a social impact perspective, right, just broadly, whether it be performance or otherwise, is that something we should be putting into the commentary in our social baselines and in how these things may be affecting it, or is it something that we just need to have in mind when we're doing the work?
I think it's particularly important if we're thinking, like, particularly, I mean, we've talked a lot about the perspective of, the private sector proponent and the developer here, but if we think from a government point of view, there are, if we there's some really interesting complex stories between the race towards renewables, the need for critical minerals, and how that impacts on communities.
Yes.
And so I can make a really clear link between, and at the moment, kind of governments are responding to that, to like, well, we're just going to fast track these critical minerals projects, or we're going to fast track these renewable energy projects. Now, this is going to sound like a contradiction in terms. I actually think you can fast track, but in a fair way. It's hard, but I think you can fast track fairness. But we need to understand that whole conversation around rapid development of critical minerals projects, rapid development of renewable energy infrastructure, as well as projects, has got a major global driver behind it. And the pace of change is coming. And so how governments design policy in the space, how they say this is how you interact with communities, I've got a real fear that they're going to start kind of going, well, actually, one of the thing that we've got to give up here is interacting properly with communities.
That's my fear.
That's just going to slow us down. Now, I think that's wrong. I think the engineers would always say, water will always find a way, and I kind of think like community sentiment's the same, which is like you can take communities out of a regulatory process. You can take them, you can deny them a voice. They will have their voice whether you like it or not. They will find a way if they feel that they are not given any other options. And so when I talk about linking the geopolitical to the local, I think there are decisions being made right now inside state and federal governments around the world where, and I'm seeing this in lots of places going down that fast track approach, where they are thinking about engineering the voice of the community out. And I think that's actually going to slow down the renewable energy transition. I think it's going to create really significant risk.
Well,
and yet for us to communicate that as social performance or social impact professionals, we actually do need to understand those high-level political and even geopolitical drivers that are at play here.
I agree 100%. No, I would go back even further and say that they made these decisions without the voice of the community already in terms of speed. And if,
100%.
Do we need to go so quickly into renewables? Do we need to shut down this? Do we need to pursue some of these things? Or maybe it's the pace. But the thing is, they didn't ask the community. They've made decisions already without community consent. The further they go down the track with continuing to double down on that sentiment of, well, we can fast track past engaging communities, then I think you're right. And I think there's plenty of evidence in history and even I think in the present time that if you're not listening to communities, then they will make themselves heard. I think also because we're living in an era where, I mean, they used to do it in the past without this, but now they've got social media connecting them. It's a lot easier for people to organise. It's a lot easier for people to make noise, to mobilise. I think it's a mistake to think that you can bypass it.
And there are also analogous tools. So if I think about my first professional experience of what people call co-design now, it was multi-stakeholder negotiation. So I was in places like Sierra Leone and Kazakhstan, and I was negotiating with governments and large multinational companies, and then some small ones as well, and communities and NGOs. And it was what we were talking about before, which is actually that negotiation is hard. It takes a long time. You get shouted at a lot for the first year. You have to build trust. Now, some of those ways of kind of creating agreements and negotiating are actually common between the two. They've got different titles and different names.
Yes.
But you can expedite projects reasonably quickly so long as you're willing to engage in those quite difficult kinds of negotiations.
Yeah. Yes.
And just as we see that sometimes doesn't happen at the local level, sometimes it doesn't happen at the national or even the international level.
Yeah. I like to call it going slow to go fast.
Absolutely.
It might appear slow at the beginning, but in fact, it'll help you go faster because you've got people are on board, people understand, people feel like they're giving consent as you go along, and then that gets momentum. The problem they have is that they start off fast and then they lose momentum and then they get clogged down and they're doing it in the reverse to what they should be doing.
I think they also get caught up in this kind of slightly comms construct of kind of like a success is everybody loves us. Right? So a lot of organisations communicate purely in positive. What I know from a number of projects is that you can get to the end of that process and people can still be really pretty unhappy with the project. But I've had lots of conversations where someone will say, "Oh, I'm still really unhappy about what you're doing. I'm probably still going to object, but I respect the process. But I respect the fact that you've turned up every week."
Yeah, I think,
and if we could just get beyond that need for some sort of weird dopamine hit of someone telling me that they're happy and love the company, that people are still going to be unhappy at the end, but they know they've been through a fair process. They know they've been engaged with respectively. Then that's a real opportunity, and it's a real opportunity in terms of how you negotiate internationally. It's a real opportunity in terms of how you negotiate locally.
I love that you draw that distinction, that commonality between, there might be different contexts, but a lot of those approaches and ways of doing things aren't that drastically different because we're all people, regardless of where you're doing it. We're all people, and we might have different contexts and we might have different things, but the one thing we have in common is we do want to feel like our voices have been heard and we've been understood, not necessarily consent, not necessarily agreement of the time, but at least that we've been heard and considered. I always say, I'm not doing a social impact assessment well if the people who participated in it can't see themselves in the assessment. They should
Absolutely.
hear even if they don't agree, it doesn't mean like I don't need them to agree with the assessment that I've made of it, but they should see and hear that they were considered in that assessment. And I think that's the distinction I quite often make.
Spot on. And that process of recognizing each other as fellow humans, I mean, it sounds a bit woo, but, like some of those negotiations I was doing, I remember there was this excruciating negotiation which I was doing in Kazakhstan for a couple of years. And these were NGOs who had been, not just locked out of the room, but actually locked up for quite a long time. And had been released from jail and then eventually brought into the room. And I can remember having this moment with like sitting around the table, and there was kind of a big multinational oil company, there was the kind of the government minister, kind of one of the local NGOs. I was just sitting there kind of going, you guys are all actually solving a problem together, and 2 years ago you were in jail. And that recognition of all sides having something to bring was pretty extraordinary. So I feel like here I am kind of 10, 15 years later, pretty much just doing the same, just in a slightly different context.
I think that is a beautiful way of putting it, and demonstrating just how things can look kind of on the surface like almost impossible, but with the right process, with the right intent, and also with a commitment to see it through, to see that process through, to give people those voices, to let them hear, to let them come to their place together. And I think we've seen this throughout history. We've seen circumstances where people would have thought this is never going to, and it does resolve. Things can move, but you've got to create that environment. So on that note, I think I'm conscious of the time and want to let it go there. Thank you very much, Sefton, for joining me today, for giving me your time. And I'm sure the audience has enjoyed the discussion. So thank you very much.
Cheers, Andrea. Thanks a lot.
Thank you. Thank you for watching. And if you're listening, thank you for listening. Remember to hit the like button, share it with your friends, and subscribe. When you subscribe to the channel, I get more interesting guests, and we can all learn, grow, and share our stories together. Thank you for listening. Remember, hit the like button, share, subscribe.